Hello, we are group 319 and today we are going to be talking about croup, its causes, symptoms and methods of treatment.
Croup, also known as laryngotracheal bronchitis, is a common disease for children caused by a viral infection of the larynx, resulting in a unique barking cough noise and inflammation of the upper airways. It is the second most common cause of respiratory distress in children. Viruses such as influenza and parainfluenza are usually what causes viral croup. Children from ages 6 months to 3 years old are likely to develop croup and have discomfort in the upper airways. Typical symptoms for croup are fever, hoarsening or barking coughs, coryza, also known as having a blocked nose, or shortness of breath. Croup symptoms are usually worse during the night, and symptom severity for croup can be categorized into mild, moderate, severe, and life-threatening. Mild symptoms would be the occasional barking, coughing, minimal stridor, and normal heart rate. Moderate symptoms would include frequent barking, coughing, audible stridor, increased heart rate, and fatigue. Severe symptoms get worse as barking, coughing becomes a lot more frequent, as well as stridor, and indrawing of the sternum lethargically, and also distress often occurs. Lastly, children at the stage of life-threatening symptoms would suffer drowsiness, significantly lethargic, and either increased heart rate or fallen heart rate.
Croup is a viral infection which should be treated urgently by pediatricians. The best and worst possible outcomes depend on the level of severity of the condition. Croup can be short-lived, usually lasting between 2 and 5 days. If the child is classified as mild, the best possible outcome is that the condition would eventually resolve itself, known as self-limiting. In severe cases, the best possible outcome would be continued swelling in the airway, which can increase pulmonary pressure and making it extremely difficult and exhausting to breathe. However, the worst possible outcome of croup, if left untreated, would include exaggerated movement of the chest muscles and noisy breathing due to the complete blockage of the child's airway. In extreme cases, death can occur with an estimation of 1 in 30,000 cases resulting in death because of a lack of oxygen supply reaching the child's blood. The child's mouth and lips may begin to turn blue, signifying an inadequate supply of oxygen to the tissues of the body.
The cost of treatment of croup is related to the severity of the patient's symptoms. One of the most cost-effective, evidence-based treatments of croup is the administration of an oral corticosteroid such as prednisolone or oral dexamethasone. Corticosteroids help to reduce the swelling experienced by the child, therefore alleviating some of the symptoms they are experiencing, such as difficulty breathing. Studies have shown that the use of corticosteroids, specifically dexamethasone, decreases the severity of the illness and decreases the necessity for the use of subsequent nebulized adrenaline treatments, or the number of treatments required in children suffering from croup. The use of dexamethasone on children with croup also decreases the number that are readmitted. In most cases, only one 0.6 mg per kilogram dose of dexamethasone is required for the duration of the illness. Oral dexamethasone can be taken either as an elixir or a tablet, though the elixir is likely to be the preferred option, especially as croup generally occurs in younger children.
In more severe cases, alternative treatments such as Heliox are used to prolong the intervention of intubation. Heliox is a mixture of oxygen and helium gas administered via a mask or tube. It is not recommended due to the complexity of the treatment and the low atmospheric abundance of helium gas. Overall, it is not the most cost-effective treatment. Helium alone has no pharmaceutical benefits. However, when combined with oxygen, it can reduce the work rate of breathing and improve the efficiency of gas exchange with no adverse health effects. As most cases of croup are acute or at worst moderate, corticosteroids are the recommended treatment. It is more cost-effective and accessible and is more evidence-based with greater levels of research.
If patients with severe croup need to administer adrenaline, they should be taken to the nearest hospital to be further treated by doctors or nurses. Pharmacists will also be helpful to provide any medication for children such as paracetamol or ibuprofen to prevent discomfort for the child. Children suffering from croup should be cared for to avoid any discomfort and further symptoms from occurring. A patient with mild croup symptoms can see their general practitioner.